Hi everyone, welcome to the YouTube channel fmge Doctor. We have already seen all the topics from the GI surgery. GI surgery is actually the use unit, and generally 70% of questions from the GI surgery itself. And the second best unit to start with is the urology. Okay, so first start with the GI surgery, finish them, then start with the urological surgery. So we will see about the first the start from the starting, like from the testis, then we'll go to the urethra. In this video we will see about the testis and the urethra and a little bit about the bladder. Okay, so when we start the urological surgery, we must start from the testis. Okay, so in testis, we will first see the anatomy. Anatomy is actually important. So many times they ask about the arrangement, like from the you have the reti testis, epididymis, then vas efferents, vas deferens. So they will ask you to order in the arrange from the start to end, like that. So you have to know the arrangement of each and every parts in the sequence, and they will sometime ask about the seminal vesicle, sometime ask about the epididymis from the anatomical point of view and physiological point of view as well, like capacitation. They ask, where the sperm get mature, where the capacitation process of the sperm starts. So have the little bit idea about the female genital tract and male genital tract chapter from the physiology and a little bit from the anatomy. Then come to the surgery unit of the testis, and here you have to know about the surgical anatomy of the testis. Okay, and when we move to the proper surgery, first you have to know about the undescended testis. Okay, because this is the very important from pediatrics point of view. They will ask the question, like they will give you the they will ask like suppose the baby is at this gestational age. Okay, and where the testis would be uh, in that gestational age. So you have to know the answer in according to that. Read about the undescended testis. Second things you have to know about the what to say the most important is torsion of the testis. Okay, so first you have to know the clinical feature and complaints of the patient. It is very important to identify the torsion of the testis, and you must be able to differentiate the torsion of the testis from epididymitis. Okay, because the so many clinical features is same, but little bit there is a difference, so you have to study. And you have to know about the French sign. French sign is very important to differentiate between these two entities. Okay, so study about the French sign, torsion of the testis, and so many times they ask the treatment of the torsion of testis. So study about the treatment as well. Okay, and the third things we have to know about the hydrocele. Hydrocele is very important. Even the types of hydrocele also they ask. The image based question is also asked from the hydrocele. So watch upon the what to say the image based question as well, and the theoretical part as well from the hydrocele point of view. Okay, and they will ask about the surgical process name. They will ask most of the time, so study about that. Okay, and then yes, you have to know about the spermatocele. Okay, spermatocele and epididymocele. Two things you have to know about this cyst. Okay, how to differentiate between these two entities. And then testicular cancer, of course. Testicular cancer, you have to just know the the treatment part of testicular cancer is very important. Treatment part you have to know about the testicular cancer, and you have to know about the seminoma. Seminoma is a type of tumor in testis. You have to know in little bit details. Okay, because 80% time they ask about the seminoma. They give the histological image. So many times they will give you the gross anatomical image also. So you must be able to recognize that image. Okay, so this was about the testis part. When we move to the urethra, in the urethra you have to know first the anatomy. Okay, you have to know about the corpora spongiosa, corpora cavernosa. These two things you have to know from the anatomical point of view, and the types of urethra on the basis of location. Okay, you have to know. So they will give you the x-ray, and they will ask you to identify where is the damage. Okay, so it is a little bit correlated with the radiology subject. So go through the the radiology part of, I mean, urethral injury, to understand that. So they will give you the urological image, and they will ask you to identify, is this membranous urethra, is this penile urethra, is this bulbar urethra, the types of urethra you must know. So they will ask you about that. And this is related to the trauma. So urethral trauma is the second very most important from the urological unit. Okay. And in urethral trauma, of course, they will ask you the radiological image, and they will ask you the treatment. Okay. The straddle injury, so many times they ask, and they ask about the extravasation of urine in case of urethral trauma. So read about the extravasation of urine as well. Okay. They either your anatomy teacher will teach you, or maybe your surgical the surgery faculty also will teach you about the extravasation of urine. So read about that also from the trauma point of view. Okay. uh, and then some very little topic, but very scoring topic, so many times they ask. That is the peyronie disease you have to know. Okay. Phimosis you have to know. Paraphimosis you have to know. Okay. You have to know about the hypospadia, epispadia you have to know their treatment. From the hypospadia, they generally ask that the at which age of the baby will do the surgery. So focus on that point as well. Okay. So read about these all entities from the urethra. This is easy, not too much hectic type of topic. So just go through this topic once. And of course the image as well, and the x-ray as well. And when we move to the the bladder, yes, there is one very important topic. These I mean this previous 5 years they mainly ask so many times this topic, that is Fournier's gangrene. Previously it was not asked, it was the PG topic, but now these days they ask from us as well, like the FMG student, they also ask. So read about the Fournier's gangrene, okay, and Milanese gangrene. There are two type of gangrene in the surgery. In the urology section you will see that in the Fournier's gangrene and Milanese gangrene. Read about that. Generally they ask about the testis involvement in the Fournier gangrene. Is this involved, and what would you do? Would you do for the removal of testis, or you will preserve the testis? What would you do? And what is Milanese gangrene? What is the difference between Fournier gangrene and the Milanese gangrene? So read about that gangrene also from the the testicular point of view. Okay, so let's come to the bladder. Bladder, you have to know about the layers of bladder, types of epithelium of the bladder is very important. Okay. And trigonal bladder is very important. You must read from the anatomy about the trigonal bladder. Okay. So read about that. After that, you have to know the bladder stone. Bladder stone is very important. You have to know about that. In bladder stone, you must be able to identify even the radiology image. They will give you so many type radiology image. So see about look at that as well. And then of course the bladder trauma is very important. Yes, bladder trauma is very important. The mechanism of bladder trauma is very important. So watch up on that as well. And then as you move ahead, yes, you must be able to identify the cancer. Okay. And from the cancer, they do not ask generally types of cancer. They ask most of the time about the treatment part of cancer, and about the BCG. What is the role of BCG vaccine in testicular, the bladder cancer. So they ask about the BCG treatment. So in the bladder cancer, you have to focus about the treatment part of bladder cancer. Okay. And bladder stone as well, how to remove the bladder stone, what is the cystourethropy, you have to know how to insert, and what is the role of that. Okay. So you have to know all about this. And there is one pediatric surgery topic, that is known as the ectopic vesicae. Okay. So many times they give you the gross image of the baby where the bladder is outside the abdomen, and you must be able to identify, and when will you treat that baby, how will you treat, like in one go you will put the bladder inside this the abdomen, or there are some steps. So you must know about that from the ectopic vesicae topic. Okay, from the bladder. And then of course I think it is enough. Yes, so this was all about the your urethra, the bladder, and what to say, the testis. Yes. So these three topic I have covered in this. You go through this all topics name, and when you go to the solve your PYQ, you will see so many questions from that. Just solve that. I think it would be very easy for you to go for the urological section, because this is the second most important unit after the GI surgery. So read about that in the next video. We will see with the another chapter from the urology section as well itself. Okay, so see you guys. Bye bye.